Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today I have the pleasure of having Dr. Dan Fortenbacher as my guest. Dr. Fortenbacher is an optometrist specializing in developmental vision, which goes way beyond what we normally think of with vision and glasses and those types of things for kids. I've learned a lot from Dr. Fortenbacher over the years about the eye-brain connection, how much that impacts child development and functioning. We refer patients to his practice often from my clinic. We happen to be in the same state and not too far from each other, which is great. So I'm really excited to have him here to share his knowledge and experience around the role of vision, not only in improving things like reading and learning, but also things like attention and behavior. I think this is an often overlooked issue for kids and one that makes a really big difference when those issues get properly diagnosed and treated. So let me tell you a little bit about him. Dr. Fortenbacher received his Doctor of Optometry from the Michigan College of Optometry at Ferris State Universiv, and his interest in developmental vision and rehabilitative vision therapy began early in his career, working with helping children who struggled with binocular vision problems. He's a board-certified fellow of the College of Optometrists in Vision Development and lectures extensively on developmental vision, neuro-optometry, and vision therapy. Dr. Fortenbacher is a past examiner for the International Examination and Certification Board of the COVD and has served in several leadership positions at the state and national level. He's developed models of innovation in the delivery of developmental, binocular, and neuro-optometric vision rehabilitative care. Ooh, that's a mouthful. And in addition to his amazing private practice, Dr. Fortenbacher is also a clinical professor at the Michigan College of Optometry at Ferris State and an adjunct faculty at Southern College of Optometry, where he is the program supervisor for the WOW Vision Therapy Developmental Vision and Rehabilitation Private Practice Residency. So lots of exciting things that he has going on. And Dr. Fortenbacher, welcome to the show. Thank you for being here.
Thank you, Nicole. It's wonderful to be with you.
So I want to get right into this because there's so much to talk about with this topic that many parents and even a lot of professionals who work with kids with challenges don't even have on their radar as something that they need to be aware of or thinking about. So I want you to start out by just talking about how is it that a kid who's having problems with reading, attention, behavior, those kinds of issues, how is it that they can have an undetected vision problem even when they've had their vision screenings, maybe at their pediatrician, or they've even gone to the eye doctor and they've been told they have 20/20 eyesight? So, parents are thinking, oh, we've passed that. My kid's got great eyesight, no problem. Talk about how it is that vision can be connected to these things.
And this is a really important question because so often when I sit down with parents in talking about their children's vision problem, one of the first things we address is the eyesight, eye health, and glasses question. Because when you go to the eye doctor, this is fundamental in every eye exam. And it's important that when you have your child's performance as a concern that you do have a comprehensive eye health and vision evaluation. But vision goes beyond being able to see clearly. That's the paradox to this. You might assume, well, I got 20/20, vision's fine. But we also have two eyes, right? And they have to work together. And if your eyes aren't teaming together, especially when you look at near, that can result in difficulty with sustained attention. It can result in the words coming apart, overlapping when you're reading, when a child's reading. And it can also interact with the clarity at near that's not measured when you're testing it far. So you can actually have some blurry overlapping images when a child is trying to read at near. So this affects their performance, it affects their attention, it affects their reading fluency. And a lot of times if parents don't simply ask the question to their doctor, is it possible that my child has a problem with their vision that's affecting their reading, they might not have the testing done to actually probe these areas.
Yeah, I agree that that's true. I think, at my clinic, we see parents frequently who have, done their job of making sure that their child who's having reading problems or other kinds of academic issues has, had a vision exam, but when you don't know the questions to ask or how to go beyond that, it can be hard. Then parents go, okay, we were told everything was okay. And what you're saying is there are things that need to get looked at beyond just the physical health of the eyes and beyond whether the acuity is okay, whether they need glasses or not. There's other things that need to be looked at there, right?
Exactly. And I oftentimes refer to, instead of getting technical, and this is one of the things I learned early in my career, when you use the doctor lingo, it confuses people. And it's basically, if you look at your visual system, you got two eyes, you have the team. They also have to track and you have to focus. So those are the eye coordination abilities to take in visual information: team, track, and focus. Mm-hmm. Beyond that, well, then you got to make sense of what you see. So that visual processing part to the puzzle is also very much an integral piece to being able to perform in reading and in the classroom and attention. So you got the visual perceptual areas, and then after that, you got the integration. So you got to integrate those visual functions with motor skills, with balance, with listening, and ultimately thinking. So you got the teaming, tracking, focusing, visual processing, and then integration. And those are developmental processes. Those are things that we don't come into the world knowing how to do this. It's something that develops normally, naturally on its own. But a lot of the children that we see, majority of them, haven't gotten it on their own. They've got a delay in that development. And our role is to help accelerate that development, get it up to speed so that they can apply themselves more effectively.
Mm-hmm. Yeah, I think one of the things that strikes me about this whole area is just how much we take our vision and our ability to process what we're seeing for granted, right? Aside from needing to wear my glasses, I don't really think about my vision. I don't think about all of the processes that are going on in my brain to be able to take those images in, to understand what I'm seeing. I just take it for granted. And I think it's, really you breaking it down like that, if here's all the different things that the brain needs to do with the information coming in from the eyes, suddenly it makes us realize, oh my gosh, it's kind of amazing that works for anybody, right? There's so many pieces to it. And I think when we don't struggle with these things, it's easy to dismiss it. And yet, when we work with kids or even adults, who are having these challenges, you step into their shoes and suddenly you realize, oh my goodness, there are so many working parts to this and so many things that need to be working together properly for the brain to be able to make sense of this, especially in a busy classroom environment, in a fast-paced, environment. And, to me, I see that's where a lot of the behavioral challenges can come in with kids who are having these types of visual processing or developmental vision types of issues, because they're trying really hard to keep up. They're trying to do what they're supposed to do, and they're just getting overwhelmed and they're getting frustrated and they're shutting down. And then it looks like they're just a behavior problem, right? Like Johnny doesn't want to do his work or whatever, when really the underlying issue is that they're struggling with these vision problems.
Exactly, and what you've described are the emotional consequences of a visual condition when a child's trying to apply themselves and they can't do it at a level that should match with their overall capabilities in other areas. They're frustrated and they start to feel down on themselves. And they say to themselves, well, I tried that, but it didn't work, so now I can't. And now they get this attitude of, I'm just not even going to try. Mm-hmm. And so that's where these visual conditions I'm describing, which are medical diagnoses, they aren't just observational. We're talking about the one that is the most common. The medical term is called convergence insufficiency, inability to converge the eyes. And one of the things that when I sit down with a child initially in an examination, I'll say, do you like to read? And just watch their response to that. And 9 times out of 10, and the reason why they're here seeing me is because that's one of the concerns that parents have, is I'll say no, and they'll frown. And I'll say, well, when you look at words on the page, and then I'll hold my hands up, and this is where you have to kind of visualize, the audience has to visualize this. Put your 2 hands together, one on top of the other, and just slide them across one another. And I'll do that, I'll hold that gesture in front of the child and say, do you ever see words slide on top of one another like that? And a lot of times, the kids that I see that have this condition called convergence insufficiency, they will acknowledge, yeah, they see that. Now, this is the first time the parents ever heard that. Mm-hmm. And if the parent ever asks the child, do you ever see double, and they have double vision, they'll typically say no, right, because they don't know what that means. But when you show the gesture, they get it. So to your point about they don't understand what they're missing, is to them, that's their world. And this condition occurs in 8 to 12% of the pediatric population, so it's not rare. This condition of convergence deficiency is significant. And it's by far the number one visual binocular vision, eye teaming condition that's been tested and researched. Three multi-center clinical trials have been done, NIH funded. Over the course of 25 years, there's been many, many research projects to determine that this is impacting performance and that, yes, it can be treated effectively with vision therapy.
Hmm. So that, first of all, I didn't realize those statistics. That's a pretty significant number of kids, 8 to 12%, you said, who
depending on the research, yes.
Yeah. And the other thing I think that's so important there is you're saying there is good clinical research to show that these are real issues and the problems that they present. And I think that's so important because a lot of times, you know, it's easy to dismiss things that we haven't heard about or we don't really understand, right? Oh, that's some, you know, opinion or idea or whatever that somebody has. But what you're saying is there's actually been quite a lot of really good research into establishing what these conditions are, how they impact kids, and then what is needed to treat them.
Exactly. And one of the most recent publications from the Journal of the American Medical Association in the ophthalmological division was to study, yes, these conditions exist. We know convergence insufficiency, the tracking is another area. It's called oculomotor dysfunction, and accommodative dysfunction is the focusing condition. We know it exists, but the research that was done and published by the JAMA publication was to determine what's the frequency of these conditions with children that have reading problems. And they coined it developmental dyslexia. And what they found was a significant amount of children with developmental dyslexia have the binocular, accommodative, and oculomotor dysfunction. So we are seeing research that shows that these conditions are present compared to a normal reader. And then the next question is, what are you going to do about it? Are we going to do something to treat these children, or are we just going to work around it with compensatory strategies? And so there is treatment for this to help these children.
And I want to get into that because I think that's such an exciting part of what you do in your work and at your clinic is innovative ways to treat these things. I want to spell out for people, you know, so parents who are listening who might be thinking, oh my gosh, this maybe sounds a little bit like my kid, or no one's ever looked at this for my child. I wonder if this is an issue. What are some things that parents should be looking for, or what are some signs that would indicate that maybe this is going on for a child, or that this is something that parents should be delving into further?
I think anytime that you have your child struggling in reading and learning, it should be one of the things that you check off the list. I mean, it should be, let's rule this out first. And so, first of all, you have to consider when your child's struggling, let's have their vision evaluated. I mean, not just an eye health and eyesight and glasses, that is important, yet you have to go beyond that. So we have to evaluate these areas of binocular vision, tracking, focusing, visual processing to truly determine if there is an issue with that. The other areas, again, would be falling into attention and concentration. Another area that falls into a common theme that I see are children that just resist doing their homework. Homework is a battle. And we'll see that it's the visual motor, it's the visual eyes and hands working together, the copy from book to paper, or they're just burned out at the end of the day. They're just so visually stressed, they can't concentrate to do their homework. So it's the avoidance of reading, dislike for reading, the attention, the difficulty with homework. Reversals is another common theme. The children that we see that have frequent reversals beyond a certain age, usually by age 7, those should be worked out developmentally. But if it's persisting, that's a concern. And otherwise, I would say the other performance concerns could be with general coordination too. So that would be another category to look at.
Yeah, I was going to say, you know, beyond the things that you mentioned, some of the things that I just screen for, you know, clinically are things like kids who are having very immature gross motor skills or coordination problems, like are well past the age when they should be able to throw and catch a ball, or, you know, do balance activities, or, you know, things like that. And they're really struggling with that. I've seen that that's another indication too. So I think that all those things are really helpful for parents to think about, okay, if these are some of the things going on with my child, then this is stuff that I should look into further. So let's talk about the assessment and then the treatment process, because I think, first of all, a lot of these problems go undiagnosed or underdiagnosed in kids. Nobody recognizes that this is what's going on. So can you talk a bit about what an evaluation for this looks like? What kinds of things are you doing with the child? And then I want to get into how we treat these.
Exactly. And the initial evaluation does look, and this is, I want to emphasize that it's important we look at the ocular health, the visual acuity, and also proper lens application, because lenses are a critical piece to getting the eyes in balance. So if lenses are needed, that's an important aspect of the assessment. Then after that, we're looking at binocular vision, eye teaming, which begins with ability to converge the eyes. And so we have testing that is very basic, and even a parent can do this at home and on your own child. You could just use a pencil or a pen or an object, just put it in front of the bridge of their nose and move it towards the bridge of their nose and have them report when they see double. Now, there are more sophisticated ways we look at this, but the research shows that that should be about 2 to 3 inches. They should be able to converge their eyes on a pencil or a pen 2 to 3 inches. And if they can't do that, if they start to report it go double beyond that, that's a big red flag. We then look at tracking. A tracking test is, there's standardized methods we do, and then there's also a chair-side method that also can be done at home. And a lot of times teachers will do this. They'll use the pencil or the pen and have them just follow the object as they move it up and down, around in a circle, and see if the child can keep their eyes on that target. Mm-hmm. That simple test can tell you a lot of information about that child's visual readiness for reading and paying attention in the classroom. The third area is the focusing category. Now, that's a harder one for you to measure at home, but in the office, we're using lenses to measure their amplitude or strength of focus, their ability to relax focus, and their ability to jump focus from near to far, which is what you have to do when you're in the classroom copying from board to paper. So we're looking at those areas. That takes about an hour. In our evaluation process, that's about an hour a long procedure. After that, when there's a reason for concern that there's visual processing issues, we'll have them return for a more comprehensive evaluation of their visual perceptual abilities. And that takes about an hour as well. And there's a long list of things that we do to address that, whether it be from form perception to visual memory to visual directionality, which measures letter reversals. We look at eye-hand coordination. We'll do reading tests to see where they are. Is it a reading? This is an important point. Is it a reading disability, or is it a reading fluency problem? Because they're not the same. Right. You can have a child who's in 4th grade but doesn't know their words at a 1st grade level. That's more of a reading disability. That's another type of issue versus a child who's in 4th grade but reads very inefficiently, losing their place, having to reread to get the information. They know their words, but they're just having fluency issues. Mm-hmm. So those are 2 different areas that we want to evaluate. And then after that, we're looking at visually directed gross motor skills and vision and balance, and some of the visually directed fine motor skills. So that's kind of the big picture. Once we have a diagnosis, then we can sit down and talk about how we treat this. And the therapeutic part of this is like thinking of vision therapy as like other rehabilitation, whether it be occupational therapy or speech language therapy, and to some extent physical therapy. But we're really working on helping the child. And we do work with adults too. I think that's important to emphasize. But for this talk, we're working with the child on activities that are visual challenges woven into something that's interesting and fun, but has ways for them to develop awareness, feedback, and do this with distraction. So each activity is kind of like a sports drill. So they're doing activities that have visual challenges guided by the therapist one-on-one in the office, typically once or twice a week, with some home reinforcement. And in the course of time, we're evaluating their progress periodically, and we're measuring feedback from the parents, and we're also getting feedback from the therapist and the doctors working with the patient. So that's how we measure progress. In general, it takes us about 3 to 4 months to completely remediate these areas we're talking about. The more complex patients have more issues. It could be with autism, other developmental delays. Certainly that takes longer. And kids that have strabismus or a crossed eye, or amblyopia, lazy eye, that's more complex and takes longer. But the thing to understand is it doesn't have to be a lifelong problem. This can be addressed in a relatively short period of time.
Mm-hmm. That's great to lay out how you go through that process, what parents can expect from a good, therapy protocol with this, and the kinds of things that are worked on. And I know, because I've been in your office, when you talk about, visually engaging tasks or just tasks that are motivating, engaging, I mean, kids are really engaged and they're working hard and they're certainly working their brain and their vision hard, but it's an enjoyable process. The way that you go about this is to have the kids doing tasks that are meaningful, that are interesting to them. Because I know that some parents may be sitting there going, oh, the thought of, trying to get my kid to do vision exercises again. Because, a lot of us who are parents think of maybe vision exercises that we were given when we were young, or something that, the eye doctor handed them, have your child do this kind of drill over and over. It's like pulling teeth to get kids to do that. But what you're talking about is really incorporating the practicing of these skills into meaningful, engaging activities, which I think makes a big difference.
That's huge. That's so important. And it's without having that awareness and feedback and engagement, it's monotonous. And what you just described is an example of where giving somebody a quote exercise over a period of time becomes monotonous and your brain turns off. You really aren't developing anything from that. So it's so critical to have a large repertoire of variety, and that's what we draw from. Whether it be low technology or high technology, we're now on the cutting edge of vision therapy applications. I just wrote a chapter in a textbook in the latest advancements in optometry and ophthalmology on vision therapy applications in virtual reality. Mm-hmm. And so this is what we're working on now, is we're working on we're actually able to use vision therapy in virtual reality examples, not just virtual reality games, but therapy applications that have been designed in virtual reality. So that has its place in certain types of cases. Not everybody applies to that, but we use other examples of technology that makes it engaging, makes it fun, interesting. Mm-hmm. And bottom line is we get fast results, because when the patient's engaged and we're stimulating these areas, the brain catches on faster and we get better results.
Yeah. Two things I wanted to circle back and touch on, because I think these are really important. One is you talked about, treating adults as well. And I do think that's really important to mention. We're talking a lot about kids, but kids of all ages, right? Little tiny kids all the way through our older kids, our teens and our young adults, but also adults maybe who never had these issues treated, or who maybe have had a traumatic brain injury or something that has happened, later on in life that has impacted, their visual processing. So I think that is an important thing to mention, because there may be some parents listening who are applying some of this to themselves and going, wait, I have this issue, or, these are things that I had when I was a kid. Is the process pretty similar for adults as it is to kids?
It is. Actually, our adult patients are our best patients, because they're motivated to be there, for one thing.
Yeah.
And while the kids, we have the toys section and they do well and we reward them with, they can select from the toys. The adults, I don't have to give them toys for them to participate in these activities. They are there because they want to be there. Right. And age is not a barrier. That's another myth that is percolating still out there, that somehow, this only works for children. I have had patients in their 80s working with us in vision therapy. So there's plasticity in our brain no matter what age, as long as we can interact and engage in the process. So I'd say about 35% of our patients are adults, all the way from older teenagers to college age kids and older adults. A lot of the adults are with us because either, like you say, they've had the condition their entire life, or it could be that they've acquired a concussion or a traumatic brain injury. So a lot of our, again, the segment of our patients, about 25%, have had some kind of a neurological event that has also resulted in them having these visual issues. And we work through the process with them the same.
Yeah, and this makes me think another issue that we didn't touch on in sort of the list of symptoms or challenges to watch for, but I'm thinking about a particular adult patient who had a very successful course of treatment with your clinic. I sent her there because of just a lifelong history of severe dizziness issues. And you were able to identify some of the underlying, brain-eye pieces there, and she went through treatment and did really well with that. So I think that might be another thing just for people to be aware of, that maybe that's a symptom that your child, has as well, that nobody's ever really been able to get a handle on. It could be that some of these things would be helpful for that too.
Yeah, the one condition that is common is motion sickness with the children we see. Very sensitive to taking trips with family, and anywhere in the car they get easily, they're having motion sickness. And for a lot of parents, it was like, oh, he's got motion sickness, but they didn't really associate that with what we're doing. Mm-hmm. That's one of the things that resolves pretty quickly, actually. Yeah. And the reason for this is because vision ties in with a part of the brain that has to do with balance. It's called the vestibular system. So you get this visual vestibular integration. And if there's a disruption in that for whatever reason, again, it could be developmental or it could be some kind of a neurological event, that can be rewired, if you will, through vision therapy. So a common theme of the patients we see is that we call it C-SICK protocol, C-S-E-E, SICK protocol. And it's a very effective way to resolve this. So usually we can take care of that particular aspect in maybe as little as 8 weeks.
Mm-hmm. That's great. That can be life-changing for so many families, especially if this is a chronic issue. Kids who can't ride on the bus comfortably, can't, go on car trips, plane rides, those kinds of things. So that's great. I wanted to circle back too, because you mentioned more specific issues like strabismus, amblyopia, conditions that very often parents are told there's not really anything we can do about this, or we'll just do some patching, or we'll do some surgery to correct your child's crossed eyes. And I see kids who have had those kinds of traditional procedures or treatments done, and they're still really struggling with using their vision, with being able to interpret what their eyes are seeing. And I know I've learned a lot from you about that over the years. Can you just touch on that briefly for parents who are dealing with that with their kids?
Right. So the strabismus, that's the medical term for eye teaming failure. That's where the eye crosses in or turns out or up or down, or other varieties of that. But basically what we're describing there is a dysfunction in binocular vision that's more severe than the ones I was describing earlier. They do take a more advanced approach in treatment. Patching in itself doesn't treat the strabismus. Patching is designed to stimulate the sight that was lost due to the crossed eye. That's called amblyopia or lazy eye. Mm-hmm. And what we now have are techniques, evidence-based methods that allow us to treat amblyopia without having to use patching as our go-to approach. It's in a binocular approach to treatment. So patching is no longer needed as the go-to method. And that's so hard on parents and for the patient to do patching anyway. But it is one of the advancements, I would say, now, and there's more information on that on our website, and also the amblyopia project by the Vision Help Group is another resource I'll touch on. But the strabismus area is one that we, usually you might think of as eye surgery, but in reality, eye surgery is a cosmetic procedure. It doesn't teach the brain how to use the two eyes. There's a place for it, and we do from time to time refer when it's a severe form of crossed eye. But in general, it is not teaching the brain how to use the two eyes, and that's what vision therapy is for. So for patients that we treat that do ultimately need surgery, we do the vision therapy to get both eyes aware and turned on, then surgery to get them in the ballpark where they need to be, and then post-surgical vision therapy for those that are, again, the more severe forms. But the majority of the patients we see that have the crossed eye don't need surgery. Mm-hmm. And we can get the excellent results developing binocular vision. And also the ultimate is depth perception. Back to your point about not knowing what you're missing. When you have 3D vision, you can see pockets of space. And I had a patient, an adult patient last night as a progress evaluation, and he was just saying how he's just so, amazed at what he's able to see now. He said, I'm playing around with my vision. He's playing around with seeing pockets of space. Mm-hmm. And for those of us that know how to do that, it's just like, so what? But if you've not had that before, it's kind of a cool thing.
Yeah, it's amazing the things that can be done, and just to open people's minds to the idea that these things can be treated, that you don't just have to settle for, well, maybe just put a Band-Aid on this, or, kind of do a little bit of this or that and get it to be okay, that really you can, using these kinds of techniques and therapy processes, kids and even adults can develop and really can have the joy of having vision that really works for them and experience the visual world in the way that the rest of us do. And I think that's so cool.
Yes, and I want to make one other final point is that when I talk about these areas that vision affects attention, vision affects reading, vision affects sports, vision therapy by itself sets the stage for the patient to respond. And so for a lot of the patients that we see have reading problems, they still require educational support. Mm-hmm. It's not like you do vision therapy, suddenly now they're going on and they're just the kids that have visual fluency problems, they can take off. The kids that have reading disabilities, they still need educational support. Kids that have these attentional issues those are deep-seated issues. They need to work with counselors. They need to work with coaches. They need to work with psychologists to help continue. So it's a collaborative effort here. It's not like a panacea that fixes everything.
Right.
And if you have a problem with golf and you do vision therapy, it's not going to automatically make you a scratch golfer. You got to get out there and play golf. Right. So the same principle applies in other aspects of life.
Yeah, I think that's a great point. And that's one of the things I appreciate about, you and your clinic is it is a collaborative approach. There's pieces, that we offer, there's pieces that you offer. Many of these kids, especially with more severe challenges, need a team approach. And the way that I look at it is addressing these visual issues that you're talking about is part of the foundation. It sets the stage then for other treatments and for further development to rest on. So I appreciate you mentioning that. Unfortunately, we are at the end of our time together. That went so fast, we could talk for a lot longer, but I want to make sure that I give you a chance to let people know where they can find more information about these topics, where they can find information on your clinic, what are the good websites and other resources that you have?
Well, there's a lot of really excellent resources now, and one of them I want to direct attention to is a project that was put together by the Vision Health Group, and it's called the Vision and Learning Project, so visionandlearningproject.com. And it's taken all these things I've talked about and it's warehoused them into one site. It's got the research, the white papers, the videos, the books. It's a composite for parents, for allied professionals, for eye care professionals. So check that out. Also, the covd.org website. So covd.org has also Find a Doctor if you're not in the area, or if you're in an area that you aren't sure where you might be able to find a provider, covd.org. Also, our website, for sure, we have an abundance of information, wowvision.net. And so we've got the resources there. We've got examples on our Facebook page of success stories, our YouTube channel, and a variety of other materials. So I encourage people to take a look.
Awesome. Thank you so much for being here today and for sharing your knowledge and experience with us. I know that so many families are going to find that helpful. So thank you so much. And I hope that you found this helpful. Apply this information to your kids. Keep doing the best that you can for them each day. And we will see you on the next episode of the show.